Many patients I work with ask me if they ever experience vertigo again, should they try to treat themselves with the same BPPV treatment maneuvers that worked for this particular episode to resolve their vertigo symptoms. In this video, we will answer that question and I'll explain my answer. But first, just want to remind you that I am Kim Bell. I'm a physical therapist. I am the Vertigo Detective, and this video is provided to you for education and informational purposes only, to offer you hope that you can get your life back, even if you've had dizziness or vertigo. This should not be taken as individual medical advice, so make sure you talk to your healthcare providers to seek individual medical advice. Now, back to the content for today. The big question when patients have previously been diagnosed with BPPV, that's benign paroxysmal positional vertigo, or the most common cause of dizziness or vertigo from the inner ear, aka ear crystals. When patients have had that experience and they've gotten proper health care in order to resolve their symptoms completely, they might ask, if this ever comes back, say weeks from now, months from now, years from now, should I just try the same exact treatment maneuvers that worked for me this time? And the answer is no. I'm going to explain why I give that answer. I'm going to show you a research study today that I use to explain this to my patients, and why I recommend that you seek out a professional consultation with someone who specializes in treating BPPV whenever, if or when you ever have a recurrence of vertigo that seems like it's BPPV. Let's take a look at this study. Okay, so you can actually pull this study up yourself if you're interested in totally nerding out with me about this. But this is an article I share with a lot of my patients to explain the reason I don't want them to just start by trying to treat themselves with the maneuver that worked for their last episode of BPPV. And here's why. This article, which was published in December of 2017 in the Frontiers in Neurology, they looked at the patterns of recurrence of idiopathic BPPV and self-treatment evaluation. Now, idiopathic means this is happening spontaneously with no known cause. So these are idiopathic cases. Now, if you have known damage to one of your ears, say from a history of a lot of ear infections, or maybe you also have a hearing loss in that ear, or you have a Meniere's disease affecting that ear, so you have known damage or injury or disease affecting one of your ears, then it's possible that your case is not necessarily idiopathic. It's possible that you can nail down what treatments might work for your case. But what we're looking here at is idiopathic BPPV. This is people who just have a spontaneous onset of ear crystals coming loose with no known cause, and cannot necessarily track this back to a specific damage, disease, or dysfunction with one of their ears. So again, we're looking at idiopathic BPPV that has recurred and what treatments might work. So this group of authors aimed to determine, when patients have BPPV, do they have typically the same canal or the same ear related to a previous attack? And so that's actually what they were looking for. This is a really nicely done study. They looked at which ear, right ear, left ear, or both ears, and which canal in the ear was affected. They analyzed 224 pairs of consecutive attacks of BPPV. These are idiopathic attacks confirmed in 167 patients in the Dizziness Clinic of Seoul. And so over a period of time of 14 years, from 2003 to 2017. So this is a pretty good sample size. And they defined a recurrence of BPPV when the patients had developed BPPV again after at least 1 week had passed from the resolution of the previous BPPV attack. So here they go over their results, which you can check out if you want in more detail. But here is the key, folks. Here's what they found. Only 24% of these patients showed the recurrence of idiopathic BPPV in the same canal on the same side. Now, what does that mean? That means that they may not have needed the same treatment in a subsequent attack. So the treatments for BPPV are very specific to which ear is involved and which canal is involved. So if only 24% of the patients in this study showed a recurrence of idiopathic BPPV in the same canal on the same side, then we can sort of extrapolate from that only 24% would benefit from the same treatment. Now, of course, there's a lot of nuances and details in there because there's different treatments that treat the same thing and et cetera, et cetera. That's another conversation for another time. But the point is just throwing darts in the dark and just randomly attempting to treat yourself with the treatment that worked for your last BPPV episode to resolve looks, according to this study, like there's only about a 24% chance that that's going to work out for you. And that's why I recommend seeking a professional evaluation with a healthcare provider who knows how to treat BPPV if and when you ever have a recurrence of vertigo. And if you want to learn more about BPPV, you can check out my website, vertigodetective.com. Go right over here to the search and type in the word BPPV. I have so many articles that'll show up for you to learn more. And you can even go over here to the blog categories. See, as of right now, I have 73 blogs about BPPV that you can check out to learn more. I hope that information was helpful. Have a blessed day.